Yeah, these new drugs for hepatitis C have had just about the most impressive impact on practice of taking care of persons with liver disease. I have never witnessed something like this in 35 years of practice in hepatology. Indeed, these medications have been called a revolution in medicine because are allowing us to cure so many people with a disease that otherwise will be with them for 2 to 3 decades, and in many instances, unfortunately, lead to liver cancer or liver failure. These medications have been in development for the last decade. They initially were modeled after the very successful HIV medications. So this is a positive consequence of having developed initially the anti-HIV medications. What has been dramatic is that over the last 2 years there had been a pace of progress that very few people anticipated. So we have gone in 2 years from treating this condition with interferon, which was extremely difficult on the patients, to within, as I said, 2 years, interferon is gone. Very few people tolerated interferon with mild side effects. Most persons had a very difficult time with interferon. Only a small minority of persons actually get cured from it. Many persons, hepatitis C is a progressive disorder that moves to cirrhosis relentlessly, and then from cirrhosis to the next stage of liver failure, for which the only treatment these days is a huge surgery such as liver transplantation, or primary liver cancer, a cancer that was very uncommon when I did my training 35 years ago. I was called to see the only person with this type of cancer when I was training, because, quotation marks, I would not see another one during my liver fellowship. And right now, liver cancer is the fastest growing cause of cancer-related mortality in the United States. The fastest growing. It varies throughout the country. Nationwide, approximately 40% of people in the transplant list, which are about 16 or 17,000, about 40% are there because of either cirrhosis due to hepatitis C or because liver cancer due to hepatitis C. These new drugs have been having rapid approvals over the last 2 years. I would estimate in several hundred patients that have been cured just in my single practice. But nationwide is many thousands. When I was a medical student, the teacher that actually gave the lecture on physiology of the liver and diseases of the liver did such a spectacular job that I was hooked into liver since that time. And his name is Dr. Simon Sachs, and he just a wonderful teacher. You know, as often happens, a teacher makes an impression on some students that then carry on for many, many years. It's just delightful to see in my latter part of the career such a development like this. It's just phenomenal.